Dr. Emanuel, thanks for joining us.
My pleasure. Happy New Year.
Now, this seems a little odd that a doctor, a public health expert no less, would be keen to turn their back on modern medicine. Why?
Oh, I'm not turning my back on modern medicine at all. I am very much invested in modern medicine. And as an oncologist, I know many, many people who've been helped by modern advances in cancer therapy. What I want people to do is to use modern medicine to realize their ends, to realize that modern medicine is only a means to an end. And the end is to live a full, meaningful life. And at some point, you might not have a full, meaningful life because of mental disabilities or compromises, physical compromises. And then I think you need to say, well, maybe I won't use those modern medical techniques to prolong my life.
So why at 75? Why have you decided at that point you would stop accessing modern medicine?
Well, it's really about data and what happens in general, on average, to people. We know that once you hit 75, the rates of, for example, Alzheimer's disease dramatically increase, such that by 80, about a quarter to a third of people have Alzheimer's. We also know by studying people who've made contributions in the past that people's creativity and their oomph for actually being curious and to work at making contributions decline substantially after 70, really, and especially after 75. I always challenge people about name someone who's really been intellectually active, curious after 75. And if you look historically, there are very few people you can name. I happen to be someone who has studied Benjamin Franklin. I have an online course on Benjamin Franklin. He's one of those examples, but they're not common. And, I view helping others, trying to better the world as a major goal.
Is it all about contributing to the world, though? What if you are happy and content and contributing to your family and your own small world? Why wouldn't you want to keep going at that point?
So let me just say two things. Again, one of the things we have a tendency to do is to reduce our aspirations as we grow old. And I want people to think hard about what is really meaningful to them and not to succumb to just go along. Oh, yes, I'm happy. To think hard about what meaningful life, what a fulfilling life actually means to them, and to live it out. This is not a casual view that I've come to. This is a very well thought out long-term view. Now, if you happen to be an outlier, you happen to beat the averages, and you really are living a fulfilling life, not accommodating yourself to limiting what you really want to do, then I think, you can have a different philosophy. And I greatly respect that. What I want is to fulfill the Socratic view of having an examined life. Examine and articulate for yourself what is meaningful for you, what is achieving for you, and to make sure that you use medicine to realize that, not be driven by the medical imperative. Got to use all the techniques we have, no matter what good they produce.
I know you're not saying this is for everyone. This is your decision. This is about your life, your contribution. But why set an arbitrary age limit of 75? Why not just wait until you're no longer happy?
So, first of all, I totally agree with that. My partner and I have had long discussions about this. And let's say I'm Tony Fauci. He's, I think, 81 now, 82. Fully, obviously, mentally there, fully physically there. He's contributing tremendously to human betterment. If I were in that situation, yes, I might, in fact, take all the treatments. I certainly would take, a COVID vaccine and medications. But again, the article was written on average. We all imagine we're the outlier. We all can't be outliers. By definition, that's what an outlier means. On average, we're not Tony Fauci.
Well, you mentioned your partner. You do come from a rather prominent family. Your brother, Rahm Emanuel, was President Barack Obama's chief of staff. He's now US ambassador in Japan. Your other brother, Ari, runs one of the biggest talent agencies in the country. What does your family think about your decision?
Going to help me stop at 70 is their view. But, I would say that my younger brother, he tries a lot of things to improve his health. And recently I've detected a slight change from I'm going to live as long as I can to, I'm trying to maintain my health for the longest possible quality of life. And that's, I think, the important message that I want people to do. I want them to think through, what does quality of life mean to you? And then use medicines, use all the things that we can do to further that end, not be driven by the medicine just because we can prolong your life, we're going to. That, I think, is the wrong philosophy. The right philosophy is, here's what a fulfilling life means to me. And if I can't live a fulfilling life, then I'm not going to take life-sustaining treatment. So I think one of the measures we use for how good a society is average lifespan. I think that's the wrong measure. I think the right measure is what proportion of your population lives to 75 in as healthy a manner, mentally and physically, as possible. That's really what we care about, and that's the right measure. Average lifespan is only a poor approximation for what we want. And you see lots of people who are older in many of these societies sort of not really engaged, lonely, having their friends having died, their activities limited, so they can't go out and walk, they can't engage with their grandchildren, and yet living and continuing. That's the kind of life I don't want to have. And that's the kind of life I think most people don't want to have. And if that's what is happening, then I think you need to make some active choices and not simply be passive about them. Tell me what you want and what is a fulfilling life for you, and then let's make that possible.
All right, Dr. Emanuel, we'll have to leave it there. Good to talk to you. Thanks for joining us.
Thank you.